Why people feel pain. Now, this presentation is in your online learning, as I feel it's quite an important topic to discuss when we're working with our patients within soft tissue therapy and in manual therapies. And it's important to understand why people feel pain and some people don't feel pain, why some injuries cause more pain, or you might see clients that have no injury that also feel pain. So this presentation just goes through why people may feel pain and what we can do as therapists to help improve how they are. So what we will cover. We're going to cover why some people feel pain and others don't, the process of how we feel pain and how we experience pain, and understanding why pain is important in manual therapy, and how to work with clients who are experiencing chronic pain. So, what is pain? Pain occurs when the brain perceives a damage or threat of danger and needs to take a response and take action. It's an opinion of the brain that the body is under threat. And what happens is your brain processes 400 billion bits of information per second. So the brain has to decide what is important and what is not important. So if your brain makes an evaluation that you're in danger based on the information that it's brought in from all of the sensory systems, including the nocioceptors, and it needs protection, then it will send a pain response. But it is multifactorial, and it's not just based on tissue damage. And you can have no pain and lots of tissue damage, and also have pain and no tissue damage. So as an example that pain isn't always an indicator of tissue damage, this article came out a few years ago, and it was where a man in the US, I think, he accidentally shot a nail through a nail gun into his brain without noticing. What was happening was that he had shot the nail gun and he felt something brush, or what he thought brushed past the side of his head. And based on where he was, he thought, oh, it's just shot, it's gone to the past my head, and I'm fine. And then it wasn't until later when he started experiencing headaches that he went to the hospital and actually realised the nail was in his head, but he didn't notice that there was a nail embedded in his brain straight away because his brain had told him that he was okay. And this quote comes from the Mosley and Butler Explain Pain book. And this is really important when we're working with our clients to understand this. So we believe that even if problems do exist in your joints, muscles, ligaments, nerves, immune system, or anywhere else, it won't hurt if your brain thinks you are not in danger. In exactly the same way, even if no problems whatsoever exist in your body tissues, nerves, or immune system, it will still hurt if your brain thinks you are in danger. So pain is an indicator of danger, but not tissue damage. Nocioception. We discussed nocioceptors briefly in the fascia as a sensory organ online learning, and these are sensory neurons that respond to certain stimuli that are potentially danger stimuli. So nociception means danger reception, and they can't detect pain. Even though nocioceptors are often called pain receptors, they can only detect danger or potential threat. And once they have detected this danger or potential threat, it then activates the alarm signals through the body and into the brain to help you move away from that danger and deal with that danger. They're a good thing because we need to be aware when we need to move away from danger, such as moving your hand away from a hot flame or hot water. But it has to be interpreted in the right way. So sometimes these nocioceptors can overwork and respond to things that aren't a potential threat, but it tells the brain that there is danger. So the only messages that can be sent to the brain from the nocioceptors are danger. When your client experiences feelings of tearing and shearing, they're all decided by the brain. So they are feelings decided by the brain, but the messages from the nocioceptor only detect a danger or potential threat. So let's just recap on how pain is created. Now, Lorimer Mosley will definitely explain it in a more interesting way that I will explain this, but it just gives you an idea of how pain is formed. So we start with a stimuli. Now, this stimuli could be a hot flame, and you've accidentally put your arm over that hot flame. So then the nocioceptors are stimulated and activated and then shout danger and want to know what's going on. So they send these messages up towards the dorsal horn within the spine, and then there's a sorting office happens. So the dorsal horn decides on whether the information is worthy enough to go to the brain. And if it is worthy enough to go to the brain, it heads to the brain, and the brain uses that information to decide whether it's to give a pain response or not based on other different factors. So once the brain has the information from the nocioceptors, then it needs to make a decision on whether to provide a pain response. So it takes all of the information and it constructs a story based on what it has available, so all of that information available. And the evaluation of the situation is an extremely detailed process, and it includes areas such as the potential consequence, the memory and past history of what's happened before, and then any reasoning and emotions. And then based on that, it makes a decision whether to give a pain response or not. And the brain can decide to turn up or turn down the signals based on what's happening. So if, as an example, that the brain decided that fire wasn't dangerous, it would turn down those pain signals. So the brain is always in control and can make those noises and the pain response louder or quieter. And this is when people start to feel pain slightly differently, and how emotions are also involved in pain. So as an example, if you have a violinist and they hurt their finger, chances are they may experience more pain than someone who didn't need their finger for their work and their livelihood. And just in the same way, a child's pain might be influenced by who is around. And I'm sure you've all seen children that have fallen over. They've not hurt themselves, but they've looked to see if any parents are around. And if there's a parent or a carer that will give them a cuddle and give them a love, if they're upset, then maybe they would say they're in pain and they will become upset. So it's just the same. And then what we'll do, once the brain has made that pain response, it calls up then other different systems to get you out of trouble. So then it would switch on the motor neurons to help you move your hand out of the way of the fire if your hand was in fire. So it's based on lots of different factors. And then here are some of the factors involved in whether things are painful or not. So the first one is tissue injury. And if you have an injured tissue, you may feel pain, and that couples with inflammation as well. But we know that the healing times vary for different injuries. And if you have a client that's experiencing pain for years, then the tissues have actually healed at that point. So maybe something else is going on. Different coping strategies on how people cope with pain, their beliefs and what they think hurts or not or doesn't hurt. Any emotional factors, would they get an attention if they are in pain? Physical habits, if they do something all of the time and it's stopping them from doing something. Any physical impairments they may have. Lifestyle, health, social factors, so how they are feeling in their mental well-being, what their nutrition is like, their social circles, that can also influence how we feel pain. Meaningful activities. So that is the example like the violinist. So something that's important to you, chances are if it's going to stop you or hinder you from doing that, then pain may be increased. And this graph just looks at the inflammation and pain as well. So as you can see here, that you have the time of the injury, so that's when things happen, and then pain increases and goes up. And then as an injury heals and the inflammation reduces and the healing time continues, then the pain ideally should start to decrease gradually. But if someone is experiencing chronic pain and it's pain associated with what's going on within the nervous system, then the pain goes up and down and up and down. And it changes, it moves. And this is when I explain to clients that pain is weird and it happens for reasons that we don't always know about. And it can move, it can feel strange, it can be worse one day, better the next day. And then based on your client's healing times and road to recovery, when they are experiencing something like chronic pain or they have had an injury for a little while and they're frustrated, it's often because they think that road to recovery and tissue injury healing is a linear pattern, so just gradually gets better and that's it. But in fact, it changes and there could be pain at some times and not other times. It could get worse, it could get better. So I often use this example of the graph just to demonstrate actually road to recovery may go in a strange pattern, but as long as the trajectory is going in the right direction, that's what we're looking for. Sensitization of the tissues. Sensitization is where the nocioceptors are heightened and they activate the alarm signals sooner than necessary. And when clients avoid pain, their sensitivity starts to increase, but really some discomfort is beneficial for them. So when tissues become more sensitized, if they're left alone, they become even more sensitized. And actually, we want to challenge that and gradually increase their sensitivity, which is just increasing their pain tolerance bit by bit. And I describe this as discomfort rather than pain. So we can work and move through discomfort rather than pain. And it's when our words really makes a difference with our clients. If we use words such as pain, then they will automatically think of pain. But if they are thinking about discomfort, the sensitivity of the feeling of what's happening may decrease. And we can use something called graded exposure, where we gradually introduce a stress of some kind to make the tissues less sensitive. This is where there might be a certain movement that they gradually increase, or a certain type of massage technique or manual therapy technique as well. And then what we can do with our clients is we can use manual therapy techniques such as instrument-assisted massage, which can then help upregulate the parasympathetic nervous system, which can then desensitize the tissues. Then within movement can build the strength and then decrease its sensitivity and reduce the fear of pain. And this image was taken from the Butler and Mosley book, Explain Pain, and it's a great way to help clients understand the relationship of pain, the nervous system, and how we can add graded exposure and gradually pacing movements into rehab, into full function. So on the left-hand side, you have your before injury mountain and the tissue tolerance, and then the pain protection level. And there's a gap between the pain response and then also tissue tolerance. And at the top, you've got superhuman effort, and that's like a serious injury. And then in the other side, you have the after injury mountain. So the superhuman effort is still there, and the tissue tolerance of the area has reduced slightly. That's a new tissue tolerance based on post-injury. But the interesting thing is the pain protection level is even lower than that as well. So there's a bigger gap between the pain protection response and the tissue tolerance. And if you have some pain for some time, then that protection level starts to decrease even further. So although tissues have healed, they may not perform in the same way, but if the pain response happens sooner, then the clients will often avoid that. And what we want to do is try and increase that pain protection line after injury. So the new protection level is a sensitization, so it's where the tissues are more sensitive. So if we can just nudge with graded exposure and gradually push at that pain protection level by challenging the client with some discomfort in movement, but then not pain. So in summary, pain doesn't equal tissue damage and vice versa. So you can have pain and no damage, and damage and pain. Pain is a construct of the brain 100% of the time and is based on many different factors. Clients may avoid movement and guarding after an injury, which may result in a higher sensitivity to pain. And what we can do as therapists is educate our clients on how they might feel pain and what they can do to help reduce feelings of pain and improve their movement. And here are some of the resources from this online learning on pain. Hope you've enjoyed the presentation. Thank you for listening.